Great to be here and welcome everyone to obviously what is the most important discussion of the entire 3 days of CogX, COVID-19 and the Sustainable Development Goals, the impact of the pandemic and the lockdown on developing countries. Really pleased to be joined today by Adrian Lovett, the President and CEO of the World Wide Web Foundation, Gail, Gallie. She's the co-founder of Project Everyone, which works very hard on the goals. Matt Reed, CEO of the Aga Khan Foundation. So as the UN has pointed out, it's a very hard truth that we know that we could have been better prepared for this crisis. Both the Millennium Development Goals and the Sustainable Development Goals could have put us on track towards a world with access to universal health coverage and quality healthcare, and more inclusive and sustainable economies. So I'd like to talk about the fact that there is going to be an impact on how we achieve the goals. The global economic slowdown will impact poverty and equality efforts. The most vulnerable, including women, children, and the elderly, as well as informal workers, will be hit the hardest. We'll see inequality addressed, and financial flows have been diverted. So there's also good news, which Gail is hopefully going to cover for us, around the environment. And we've also seen some incredible innovation and partnerships resulting as a result of COVID-19. So Matt, let's start with you. I want you to address one of the big issues that's come out, which is this concern around healthcare and really the lack of universal healthcare. We clap for our carers here in the UK, but some of them are among the most poorly paid. They've also suffered from infection. They've been affected more by COVID than many other sectors. So taking us out of the UK, give me an example of what you've seen in your work with the Aga Khan Foundation, how it compares to lessons that we should have learned from other infectious diseases like Ebola, TB, or malaria.
Thank you, Edie. Thanks so much. And thanks everyone for joining us today. It's a real pleasure to be here and to be talking about this topic, which I think is more important now, frankly, than it ever has been. I think one of the things that the COVID crisis shows us is that really the SDGs are about getting the fundamentals right. And when we don't have those right, and when our system is out of balance, that's where you see the kind of effects that we're seeing in so many places around the world. Let me say a little bit. I think this point about clap for carers and the way that we undervalue the contribution of our frontline healthcare workers is absolutely true in the UK. It's true in the US, where I'm originally from, and it's certainly true in the developing world. If you think of the dearth of nurses and doctors in South Asia, Central Asia, Africa, Sub-Saharan Africa, we're talking, 1, 2, 3 per thousand versus the 20 to 30 per thousand in developed countries. So we have a tremendous gulf there. I think what we've seen in terms of this crisis, and let me just to say very briefly, the Aga Khan Development Network, the foundation is part of that network, is a group of 10 agencies. 3 of them are focused on healthcare. And we're working at the community level. We're working in primary healthcare systems and tertiary healthcare systems. So when this crisis started, and we started to begin seeing it on the ground, we mobilized our network in Central and South Asia, Eastern Africa, and a bit in the Middle East. 50,000 community organizations and NGOs. That includes community health workers, people on the front lines, and immediately started getting them out into communities to tell people how to protect themselves, how to prevent the spread, and what to do if people are sick, and to try as best we can to keep them out of health systems so that let's say the health systems that are there aren't overwhelmed even more than they already would be. The second thing is that we own and operate 750 healthcare facilities in those places. About 2/3 of those are on a public-private partnership basis. So we actually manage healthcare facilities on behalf of governments. So we're really involved at both the primary healthcare level, but also secondary and tertiary health. So if you look at something like the Aga Khan Hospital in Karachi, which was the first hospital to have a COVID patient in Pakistan, that is a ISO certified top level hospital. Certainly it's been ranked one of the best in Pakistan, one of the best in South Asia. Right away, I think what's interesting about it is they have They have it's a university hospital, so you have academics doing research who had already been studying this, trying to understand how they were going to be able to deal with it when the wave comes, etc. But I think what's important about our response is that although we were able to mobilize our network very, very quickly, and I think by and large health systems have tried to mobilize themselves as quickly as they can, what we've realized is that we have had to be an essential assistant, if you will, to public healthcare systems. We're trying to help build them up, even as we're also responding to this crisis. And the reason we're doing that is because if you look at the past 20 years of healthcare investment, both under the I'd say primarily under the Millennium Development Goals, and some of the very good work that has come out of our focus on what you might call the vertical programs of malaria, TB, AIDS, etc. But during the Millennium Development Goals, they had a very narrow slice of things that they were focused on. There were some things around child mortality, maternal mortality, but it wasn't about sort of general access to primary health care. It was very focused on stopping the prevention of HIV, stopping the spread of HIV and the prevention of that, stopping, say, TB, etc. And while some of those had phenomenal results, actually, in a very narrow slice of the system, actually what happened with Ebola was we realized very quickly that your best insurance during a pandemic is that primary healthcare system. Those community healthcare workers that I was just telling you about, who are able to go out into communities and educate people. And so I think that in a way you could say that over the past 2 decades, we haven't been as attentive to those carers, to those essential healthcare workers, and to the essential healthcare systems, all of which we now rely on in a crisis. And what we're finding out, unfortunately, is that many of them are not fit for purpose. They haven't been maintained over time. And that's a story that we could tell in Africa, in Asia, and frankly, here in Europe.
Thank you. So that's the healthcare side, not entirely dealt with, but let's also look at one of the parts of this crisis that has had some silver lining, and that's the climate or the environment. So Gail, tell me some of the good news. Obviously, the air is cleaner. We've seen the news this week that the UK has gone 2 months without getting energy from coal. Incredible. The skies above me here in West London are free of planes. Obviously, some of that will change. What's the short-term environmental impact, but also what will last, do you think?
I mean, I'm known as a provider of silver linings, Edie, but I don't know if we can quite call them that. Yeah, I mean, look, we've seen the anecdotal evidence that we all love, you know, the fish in the canals in Venice, and I don't know where you live, where I live, the skies are quiet, you know. And if you look at the percentage drop in emissions, the estimates are anywhere between 6 and 9%. By the end of this year, we will have dropped. My worry about all of those things, delicious though they are and silver, is if you look at what happened in the decade previous and the last economic meltdown, 2008, it's now thought that the carbon emission reduction that we thought the world was doing consciously was just simply a result of the economic situation. And similarly, no one would have wished this sort of situation to get those results. The results are great, but you know, I heard a journalist on the radio the other day say, "Oh, Greta Thunberg will be so happy." I mean, she won't. Yes, she didn't want a pandemic. And my worry is all about sustainability. You know, like genuinely, can we maintain this and up it? And I think for me, there's the silver lining is something in the consciousness shift that has gone on about what we can do. Right. So I think that the questions and demands and changes that the climate movement has been calling on from government, from business, from citizens have just seemed so huge and therefore impossible to almost engage in. But the pandemic stopped everything dead. And there was a phrase I was using a lot in the early weeks, which is, "Oh, turns out we can." You know, so, you know, it turns out we can stop industries. Turns out we can just stay at home. Turns out we can live without much persuasion. The citizens can give up a ton of stuff that they thought was necessary for their lives. Turns out we can. So what I'm hoping is that sort of new awareness and will translate into ambition for the climate movement. And I'm definitely given hope and optimism when I am in on calls and networks of the level of coordination that is now happening amongst all of those climate groups right across the spectrum, from XR through to the UN, through to COP, different governments, is this shared ambition and willingness to really kind of work together for a just and sustainable world. It feels like that old divide that we've all been familiar with before, which is like sustainability but versus development. It feels now that the consciousness shift across the whole audience spectrum is one of understanding that we are one system, and understanding that, and I'm going to sound like the goals advocate that I am now, understanding that there is no sustainable planet without equity, understanding that there is no justice without education, and the perfect kind of balance that is the wheel of the goals. I feel the pandemic has really writ large the truth of that, and I feel like people, whether you work in it or you're a citizen on the street, or you're a child or you're a frontline worker, I think everyone has felt the need to act as one in the interest of everyone. So that is I don't think we can count carbon emissions as a silver lining yet, because that's forced upon people as a dead stop. But I think a silver lining might be this new awareness that, allied to ambition, that if we all can act together to make things sustainably better.
So I'm going to come back to you as the official provider of silver linings on the Build Back Better campaign, which I do love, the 3 Bs. But first, let's go to Adrian, because for half of the world, we've seen the digitalization of pretty much our entire lives, at least my entire life, except for my walk, my daily walk. Everything has transformed to the web. It's also proved to be a way to spread information, but also inane untruths. So I wonder, Adrian, if you can give me your estimation of how the web has fared through this entire pandemic across the world.
Yeah, I mean, I think, talking about with Gail about silver linings, I do think that a genuine silver lining in this extraordinary crisis and this really tough time for everybody is, at least for those who have it, the way the web has served not as a luxury, but as a lifeline. I mean, you go back to the last pandemic on this scale, we'll refer to 100 years ago and the flu pandemic that swept the world after the First World War. New York City's main means of disseminating information, medical information, and instructions to its citizens about what to do in that crisis was troops of Boy Scouts walking across Central Park and the streets of New York, handing out little slips of paper saying, "Don't spit." Thank goodness that we have a slightly more advanced means of disseminating information about this pandemic. And it's also true to say that, and not an understatement, I think, that the web and the internet are keeping economies afloat at the moment. Not to underplay in any way the very dire economic picture that's in front of us. But the research from the 2003 SARS epidemic in Asia showed that countries even then that had good and well-developed connectivity, that they had broadband in place and so on, were able to avoid about 75% of the negative economic impacts of that crisis in comparison to countries that didn't have that advanced infrastructure. And that's going to be true today. We all see that in our own experiences. And as you said, Edie, even with the conversation that we're having right now, as well as the ways that, at least for some of us, we're able to keep working, to keep putting food on the table, and so on. And people are being incredibly innovative in maximizing that connectivity at the moment, whether it's, we've all seen the lines of vehicles outside closed restaurants in different countries of the world, where people are trying to hook into the still active Wi-Fi hotspot, and some great examples of where public health officials and city planners and so on are sort of flipping around those lessons and saying, okay, let's take Wi-Fi where it's needed. Troops of, I think, those American yellow school buses, right, that are now parked up at different times of the day in Austin, in Texas, I think, outside of apartment blocks in low-income neighborhoods, enabling children, without being able to leave home, to access the internet and to be able to get online and do homework, which is critically important in in societies where, in the US is a great example, where take New York City, something like 1 in 3 households don't even have broadband at home, and the impact on children learning as well as all sorts of other ways is really clear. So I think that there's incredible positives in the way the web is helping us get through this crisis, but also, as you indicate, there are real challenges. Nearly half the world doesn't have the web at all. 3.5 billion people around the world are getting through this crisis without that tool in their hands. Now, some of those are in Europe and the United States. 60,000 children in the UK who don't have internet at home, for example. But most of them are in developing countries. And there, what's happening is we're seeing some familiar inequalities being deepened during this crisis and beyond it. One of the most obvious ones that we look at very closely at the Web Foundation is the gender divide. And men, we know, are about 21% more likely to be online than women. In the least developed countries, that's much more a stark difference. 52% in the least developed countries, men more likely to be online than women. And so there's a different experience for women and men in this crisis and their ability to use the web as a tool. In rural areas, of course, there's a very different picture for people there than the one that we see in urban areas too. So that's why Tim Berners-Lee, who founded the World Wide Web Foundation that I lead, and who of course invented the web 31 years ago, called this week for the internet access to the web to be declared as a universal right. And it is already there in those brilliant sustainable development goals, those global goals that Gail and her colleagues are working so hard on. A little bit buried, admittedly, number 9, part C, is where you find the ambition to get the world connected and ensure that everybody can access the web. Now, the goal, of course, for that was this year, 2020. We're not going to hit that. But perhaps by 2025, we can get a long way towards that target. Perhaps by 2030, we really can have everyone connected to the web, because it's in a crisis like this that we see that really is a matter not of a luxury, but a lifeline that we all need and we all should have access to.
Thank you. So I am a little worried because I have a podcast called the Global Goals Cast, and we tell the stories of those champions who are making the world a better place, and work a lot with folks from Gail's organization. Adrian, I've interviewed you before on these subjects. And one of the things that we like to say is that we are purveyors of optimism, and that there's no time better than now to be born, especially if you're a girl. But I do wonder if this is not the case anymore. Matt, I've noticed on your Twitter stream recently, you were talking about a rise in early marriage and child labor in Afghanistan, one of the countries where you operate, since the onset of coronavirus. I've seen some reports from India saying that migrant laborers and also women who are part-time workers or who are just entering the labor market are now being pushed back out. So I wonder if you can talk me through this, and if anything, what we can do.
Well, thank you very much. I mean, I think it's a very good point. I mean, we're not sure it's happening, but if it's what we think it is, we think it's very likely based on what we've seen in previous crises. Just to speak, specifically about Afghanistan and some of these other countries. I mean, what we are doing in Afghanistan, for example, right now, we're working together with CARE, Save the Children, under a DFID funding grant in 3/4 of the country, promoting girls' education. Now, we've been doing that in our network for over 20 years. We were there working house to house under the Taliban to get girls educated and to begin bringing those values into communities. We have since then been working, like I said, in 3/4 of the country at the village level, trying to really create a whole village approach, actually, a community-based approach, where you're working with parents, you're working with elders, and all working around all of those things that keep girls from getting in school. Those things are not always ideology and preconceptions. Sometimes they are, but a lot of times they're just practical concerns about, are they going to be safe when they walk to school? Do they have toilet facilities? If they're menstruating, is there a place where they can go if they're having their period, et cetera, et cetera. So during this crisis, what we very quickly realized was that a lot of these girls, because their schools were closed, because they had to go into isolation, they were alone. They didn't have any support networks anymore. We weren't able to engage with the same kind of the support networks in the way that we had been. So very, very quickly, we mobilized a WhatsApp group in the middle of rural Afghanistan. I mean, back to Adrian's point, what's extraordinary is the way that very, very quickly, as a result of necessity, even in places where you would think that technology hasn't made that big a difference, we've been able to get it to make a difference. And so we got women teachers. One of the big things is making sure you have women teachers so that they can reach out to girls in their homes without raising suspicions and without getting their parents upset, etc. So we had organized them very quickly. How can we provide them support? How can we continue to provide them with some educational opportunities? And we've been doing that in Afghanistan, in Pakistan, in Kenya, Tanzania, Uganda, you name it, everywhere we work. In fact, we have a group, we call it Schools 2030. It's a collection of 1,000 schools in 10 countries. We're doing this with 10 other foundations, where we bring together teachers from those countries to talk about what works in education. So we just had our first online global webinar for all of them to talk about how are they dealing with online, offline, remote working, home working, what's working for you in remote Kenya, what's working for you in remote Pakistan. And some people they were calling in on their handheld phones. Some people were able to log on like we're logging on, but we were able to make it work through a combination of technologies. And that's something we wouldn't have been able to do before. We wouldn't have been able to leverage these innovations and expertise. I think that's something that is quite extraordinary coming out of this crisis. That said, you started with a stark warning. We have to be very, very careful about this, and we need to redouble our efforts to get girls in schools, stay connected to these kids, and try to do what we can to bring some continuity of service to them.
It's interesting because I was actually, just before lockdown, I was in a refugee camp in Kenya, working with a whole bunch of girls who are learning to code in order to be able to join the fourth industrial revolution. And they all were sent home. We got put on an airplane to come back here. Kenya closed its doors, and they all got sent home from school. So, and I know a lot of those girls were there and were not allowed to leave the confines of the school, because if they did, the risk was that they were going to be married off to a friend of the father's. So the risk is absolutely real. Gail, I want to bring you in here, and I want you to talk a little bit more about this idea of building back better, using some of the innovations that we've seen, that Adrian has talked about, that Matt has talked about, and from your lens, looking at climate or looking at any of the goals, what would you highlight here?
Thanks. I mean, I think just to start that question from that perspective of optimism versus pessimism, I think the global goals, when they came out in 2015, they were always positioned as the roadmap, right? They were a plan, maybe not a perfect plan. Adrian, I'm sorry that you didn't get the internet as goal 18. I know there's lots of discussion about that at the time, but it's in there. They're a plan to get us to a better place. And we were all geared up this year, I'm sure that everyone had their plans, to mark 5 years that the goals had been in existence and 10 more years to go. And the phrase we were using was a decade of delivery, right? And, with hindsight, perhaps we had a lucky few years, in the sense that there was good progress made. It felt like there was progress being made up towards the COP, in the UK. And some of the indicators were traveling in the right direction. But what again, hindsight and looking back, every goal is vulnerable to an incident. So the one that sticks with me is that the hunger goal began to go backwards because of the conflict in the Yemen. But we didn't do anything about it, right? There didn't seem to be a global response to that. Like, oh my God, the plan's gone off track. Let's all mobilize and fix that. And maybe what has happened through the pandemic, and there's other crises, which I hope we'll touch on soon in this conversation, but the pandemic was such an enormous intervention in the plan that it's made everyone realize that there's, we all, each as individuals, have viscerally felt, I might die. It's just like the ultimate intervention in your ultimate plan, one's own life. And it feels like there's been this mass galvanization of caring. It's just made me think there. I was in America at the last election, and people who stand for things that the incoming president does not stand for were almost immediately galvanized. People were out on the streets the next day as, LGBTQ, female, race, you name it. People were on the march because they realized that there was a large threat to their beliefs and what they were trying to do. And I am hoping that the pandemic has created that global sense of commitment to the better world that the goals represent. Now, you don't have to go out on the streets with a goal flag. I mean, it'd be weird if you did. I mean, great, but weird. But everyone who is fixing, whether it's the sort of on the ground instances and issues that Matt was just talking about there, or the myriad of other solutions, local issues, or macro campaigns, they are all adding up to a better world. And I wonder whether, sure, right now is not a great time to be alive in terms of, recession and pandemic and protest, etc. But the long game, and by long I mean the decade of delivery, could be where we see the benefits of this. If we can harness this energy, if we can harness this fear and turn it into desire for change. There are surveys coming out that show that people are aware that we were sort of on the wrong train, especially in the climate world. And I think now what's emerging is in the racial world and in the justice world and in the, the equality and the education world, we weren't going in the right direction, and certainly not as fast as we should be. And so I'm hoping the energy that is coming out of the pandemic will turn into positive energy to this lovely phrase, build back better. And again, depending on where you sit, you might want to build back greener, if that's your thing. You might want to build back fairer. You might want to build back safer. And that is all this within this. And I think it's something that governments and businesses have very quickly got hold of. The hashtag is all over the place. People are writing articles about it. People are internalizing it. What I'm super interested in next, the Worker Project, everyone, along with lots of our partners, is interested in is how can we almost operationalize building back better for citizens, for communities of all geographies, ages, genders, races. What does that mean? What do I want my world to look like? What does better look like? And how can I do that? And then I think the role is to connect up the governments and businesses and citizens in that triangle, as it were, to affect change for a better world.
So I wonder, Adrian, could you touch on that? Is there a build back, more inclusive in terms of the web movement that you see coming through in the work that you're doing with the World Wide Web Foundation?
Absolutely, yeah. I mean, I think we see this as an extraordinarily important moment to make a new commitment to use all of the kind of energy that's being applied at the moment, quite rightly, to address this crisis. Whether it's in getting the necessary healthcare in place, whether it's in fighting misinformation and getting the right information across, in keeping economies afloat and so on, all sorts of energy being expended to address this crisis. At the same time, we've got to make sure we're looking to the next crisis, to the next decade. And, Gail is pointing to a lot of that. And I think, one of the things that we've been working on in the last few months and just announced some work on at the Web Foundation is around the notion of meaningful connectivity. It's a bit crazy that those of us taking part in this conversation, who probably have more than one device at our disposal, who have relatively reliable internet connection, who have access to those devices most or all of the time, that when it comes to measuring who's online and who's not, we get put in the same category as the teenager who has to go, several miles across town to a free Wi-Fi hotspot to get online maybe once every couple of weeks with limited data and slow downloads and so on. Those are completely different experiences. So we're talking about a big push on meaningful connectivity. Yes, half the world is online, but of that half, or just more than half now, we've got to level up the experience of people being online. We've got to make sure that people have got smartphones in their hands, that they've got regular access and use of those, that they've got decent download speed and so on. And so there's work for companies to do when it comes to making that a reality, for governments to do, and for all of us as citizens to do. And we've brought together those three groups in this idea of a contract for the web, which aims to deliver the necessary ingredients of a web that really does work for humanity, rather than the other way around, a web that really is for everyone. If we're going to realize that vision, that original founding vision that Tim Berners-Lee had for the web 30 years ago, then there's things that governments have got to do, companies have got to do, and all of us as citizens have got to do to make that a reality.
So, Matt, I want to bring you back in. I wonder if you can talk me through some of the partnerships that you've seen develop. I mean, one of the things that I covered on the podcast, for example, was I spoke to some frontline health workers in Kenya and in Uganda. And one of the things that was happening actually in some of the slums was that for the first time, despite years of asking, we were actually seeing taps being put in. And so people could wash their hands. And as a result, actually, in some of these areas, we saw a decrease in diarrhea. So there's obviously a great connection between the goals there. There's a great connection between partnerships between NGOs and local and civic authorities. I wonder if you can give us some examples of some other partnerships that might have worked that you've seen through your work through the foundation that you might be able to share.
Sure, no, I'd be happy to do that. I mean, I think for me, that's one of the things. I mean, there are two things that come out of the crisis for me about partnerships. I mean, on the one hand, for those of us that read the headlines, we could be quite disappointed actually about the level of international partnerships that you see in the multilateral system, sniping about the WHO, et cetera, et cetera. That hasn't actually worked out as well as we think it ought to have done. On the other hand, I've been very impressed by how quickly philanthropy, business, and governments, local governments in many instances, have come together to with a sense of purpose and a focus to try to figure out what is it that we need to get done. And so your example from Kenya is a great one. I mean, I would say, for example, let me go back to Pakistan and Aga Khan University. I mean, Aga Khan University Hospital runs about 250 clinics in that country, 6 hospitals. It's treating patients on the front lines. The government of Sindh came to them and said, you've been treating the first patients. We know you've been tracking this since Wuhan. We need to train up our nurses and doctors across the entire healthcare network of Sindh, the public healthcare network, on this. Well, we already had in place an e-health program and an m-health program where we had been doing online trainings for people. We used to do them for 50 people. Now we're doing them for 500. Where we're actually training very, very quickly in real time doctors and nurses in the Sindh healthcare system in local language. What do you need to do? What are the protocols you need to do? How do you treat patients? How do you protect yourself? That's been very, very quick. The thing that I talked about earlier, this educational partnership with these 10 foundations, I mean, their response has been extraordinary. I'll name a few. I can't name all 10 of them, but IKEA, Lego, Wellspring, our foundation, et cetera, and their Oak Foundation, Jacobs Foundation. I mean, what they've done is very, very quickly come together and said, you know what, we're going to pivot. We know that this is the crisis of the day. We've got 1 billion plus kids out of school. We need to figure out in these 1,000 schools what we can do and what's working. And I think that sense of urgency really permeates all of this work. And then outside of our network, I would have to say that I'm very impressed with the kind of collaborations that we see around vaccine research or the development of therapeutics. I mean, just actually to speak about the role that philanthropy is playing. I mean, so yes, you have corporate government efforts around vaccine research and all the rest, but there's a whole other effort led by Wellcome Trust, Gates, an organization called CEPI around vaccine development that's looking at what is the whole supply chain? What's the whole ecosystem you have to have in order to produce vaccines and therapies, produce them at scale, distribute them at scale, and distribute them in the parts of the world where they are, so that we aren't all reliant on that one factory in south of China or in India or in the US to provide our personal protective equipment or whatever it is. So they're looking at that entire supply chain and trying to anticipate it in advance and then using that knowledge to help governments and companies and others think about where they should be making their investments. That's an extraordinary kind of cooperation that has just come about almost overnight, actually. And so those are the things that when I see that, I think a little bit what Gail was saying. If we can do that around COVID, imagine what we could do around so many of these other pressing challenges.
So, Gail, I want to talk about the issue that's also on everyone's mind at the moment, which is the whole issue around George Floyd. We're 4 white people here. We cannot get away from the white patriarchy or matriarchy or whatever we are. But racial justice and the idea of justice and equality is very much baked into the goals. It doesn't always get talked about, but it really is central to the issues around equality, around making some of those things better. So I wonder if you can tell me, based on what you know about citizens and power, how you think this feeds into the discussion that we'll see coming out of COVID.
Yeah, well, thank you for raising that. And, like all of us, I'm sure we speak to this one with huge humility, and I'm approaching this issue with mainly learning in mind, because this is something that I realize that I don't know enough about. But I have been listening and watching. There was a very good Obama Foundation town hall last week where a lot of younger people in America, both affected and working in the justice system, were speaking about the causes there, the long-standing causes. I was listening to the writer Efwa Hirsch yesterday, talking, a UK black female writer who, made the point that we in the UK can't talk about system reform in the States without admitting that we invented that system and exported it. The issue, racial justice is a problem. Equity is a problem all over the world that is metastasizing right now with real energy, explosively so in America. But what I take from it positively is look at the speed of change, right? Look at the not just the outpouring of protests, and that look at how that is spreading around the world. Look at the solidarity that we're seeing in action there, but also look at the policy changes. The mayoral changes that are being made almost in real time to policing in the States. The 8 for 8 campaign, 8 Can't Wait campaign about the chokehold. The thing that allowed that murder to happen in the first place. Certain states have already taken that out of their policies. So I think apart from a huge dose of humility, I think it shows us that citizens are engaged. They are feeling a solidarity with each other all over the world, even on issues that they didn't think were theirs or that had anything to do with them. They are coming out and they are saying, we want this to be different. And I think really what this sort of terribly explosive and incredibly sad, painful incident, one man, George Floyd, but look at the rest, watch the 13th and see all of them. And these are just the ones we know, right? The names we know. If what can come of that, I hope, is a renewed sense of potency and energy and partnership between those affected and those able to make the change. Because I think that is the way that we will get to this situation where we build back better. That in a way, at the heart of all of this is the grotesque inequality that we've ended up with in the country on any level, whether it's gender, race, poverty, accessibility, connectivity, just an unstable level of inequality. And citizens have woken up to that, I think. The pandemic started it in a way. George Floyd has heightened it even more. There could be something else until the end of that's one principle. We don't know what the next one is. But I think what people are waking up to is the fact that they can do something about it. And that if they work in, and governments and businesses realize that they can do something about it. So if we all want to do something about it, maybe we'll do something about it, right? Maybe now we'll actually sort it out.
Thank you. So I think for me, one of the hardest things about this entire experience has been holding that duality of the horrid and sometimes the quite beautiful together at the same time. And that has been one of the things. The other thing that has been so extraordinary that we've been talking about here is that this whole thing, we experience it in real life, whether we know people or not who've been affected, but also online. And that online aspect has had some sharp edges. For the first time, I think we've seen YouTube coming in and taking things off of its platform, questioning whether lockdown should have happened. So, Adrian, I just wonder if you could touch on this issue around freedom of speech and whether we've learned anything from this pandemic. The web is still a relatively new technology. So I wonder if you think that there's been a milestone that we've passed related to freedom of speech that you might like to talk about.
Sure. Yeah. I mean, I think specifically on YouTube taking things down, I think actually in relation to content around discussion about whether lockdowns are a good or a bad thing, I think the issue is not so much them removing content, but essentially burying it, as you say. You can't find it through a search and so on. So yeah, there's definitely a debate to be had there, and of course, as advocates of the vital importance of free speech, we would be clear as anybody that debate about the merits of different responses to the crisis is surely necessary, and there should be space for that. What I would say is that there is an epidemic of misinformation online right now about this crisis, about this pandemic, and there's two things that do need to be done in response to that. One is to elevate clearly accurate, truthful, and necessary information, necessary in the sense that we all need to see that, to whether that's about social distancing or whatever. That information needs to be elevated, and the social media companies have a job to do there, governments as well, to make sure that happens. Secondly, we do need to see action to suppress harmful untruths. Now, there's that isn't necessarily some of the stuff that's been in the press around lockdowns in the last couple of weeks, but of course there's a huge amount of deeply harmful, untruthful content, recommending particular cures, so-called cures, or urging, the adoption of a conspiracy theory approach or whatever. And those things are going to cost lives in a crisis. So it is right that companies and governments are challenged to act on that. But also, I think, and just to tie it back to what Gail said, I think it also then is on all of us, isn't it, as citizens? Tim Berners-Lee says often that, he may have invented the web, but everyone else built it. We all have added a brick or two into that extraordinary creation over the last 31 years. And as co-creators, co-builders of the web, we all have a responsibility to protect it and to make sure it serves the purpose that it was intended to do. So that means us being skeptical about some of the things that might get sent to us, about whether we're going to forward them on before we check where the source is from. It means us being smart and kind of thoughtful about calling out hate speech and calling out harassment when we see it, and taking action to make the web a more respectful and civil place. So all of those things are in our hands too. I think it's not just the companies that need to act, not just governments that need to act, but all of us as web citizens, as citizens of the world, have a part to play to make sure we get through a crisis like this with those fundamental values that we have of freedom of speech protected, and with safety and public safety in a crisis necessarily at the heart of our thinking.
So if I can, I want to sneak in one more question to Matt, which is just remind us of the importance of vigilance. We are entering into what is likely to be the largest recession that any of us can remember. In fact, I definitely can't remember anything worse than what we're about to. So just give us a reminder of what we need to be vigilant about.
Well, I mean, it comes back to exactly what Gail was talking about, which is this tremendous divide between the haves and the have-nots, and the really gulf of inequality that defines so much of our lives, both all around the world right now. I mean, if you look at the scale of the international response, which has been very, very impressive, but also very, very domestically focused, $1 trillion in the United States, almost $1 trillion being proposed for Europe, for example, 500 million here in the UK. And then you compare it, let me just give you an example. At the beginning of May, the EU held a global pledging conference about vaccine research, and they raised 7.4 billion euros in a single day. For a month prior to that, the UN had been asking governments to contribute to its emergency response to COVID, and they raised barely $1 billion in a month. I think that underscores the degree to which an international response and coming together around these fundamentals, the SDGs, is at risk in this next upcoming crisis. And we just have to all continue to make the point that we are investing in the fundamentals by keeping people safe in Africa and in Asia. We are keeping ourselves safe in Europe and America and Latin America. This pandemic has underscored that, I think, more clearly than anything else could, but I worry that the economic depression to come will keep us from making the investments that we need to. And I would just urge us all to keep focused on that wider set of issues.
So it's unfortunately time for us to go off for a few minutes, but we're going to remain here chatting amongst ourselves. We very much hope to invite the audience to come in a few moments, but it's time for me to now pass back to Jess. Thank you very much to Adrian, to Gail, and to Matt from me.
And thank you very much for such a fascinating session. You touched on so many different topics that are so relevant right now, and we're just so lucky to be in your audience. So thank you. Everyone who is in our wonderful CogX audience, I hope you use this 12 minutes wisely. You have some time to stretch your legs, get up, do a bit of yoga, make a cup of tea, and then return in at 4 o'clock when we'll be having a Q&A with all of those fantastic panelists and come up with some really, really great questions, because they're all incredibly expert in a wide range of incredibly topical issues, and I think we all have an opportunity now to learn from them. So come back, and then later on we'll have sessions looking again at AI and whether AI can be taught to police itself and if it can regulate its own ethics, and then a final session on privacy, and then that's it. So please do join us at 4, 5 and 6. Have a great time.
Want access to more CogX videos? Subscribe now for free at cogx.co.